Hello, welcome to my presentation. Semester 3, Paper 3, Unit 1st, Topic Basic Concepts of Ecotoxicology. Types of toxic substances. There are generally four types of toxic entities: chemical, biological, physical, and radiation. First, chemical. Chemical toxicants include inorganic substances such as lead, mercury, hydrofluoric acid, and chlorine gas, and organic compounds such as methyl alcohol, most medications, and toxins. Second, radiation. Some weakly radioactive substances such as uranium are also chemical toxicants. Most strongly radioactive materials like radium are not. Their harmful effects, radiation poisoning, being caused by the ionizing radiation produced by the substance rather than chemical interactions with the substance itself. Third, biological. Disease causing microorganisms and parasites are toxic in a broad sense but are generally called pathogens rather than toxicants. The biological toxicity of pathogens can be difficult to measure because the threshold dose may be a single organism. Theoretically, one virus, bacterium, or worm can reproduce to cause a serious infection. However, in a host with an intact immune system, the inherent toxicity of the organism is balanced by the host's ability to fight back. The effective toxicity is then a combination of both parts of the relationship. In some cases, example cholera, the disease is chiefly caused by a non-living substance secreted by the organism rather than the organism itself. Such non-living biological toxicants are generally called toxins if produced by microorganisms, plant or fungus, and venom if produced by an animal. Fourth, physical. Physical toxicants are substances that due to their physical nature interfere with biological process. Examples include coal dust, asbestos fibers, or finely divided silicon dioxide, all of which can ultimately be fatal if inhaled. Corrosive chemicals possess physical toxicity because they destroy tissues, but they are not directly poisonous unless they interfere directly with biological activity. Water can act as a physical toxicant if taken in extremely high dose because the concentration of vital ions decreases dramatically if there is too much water in the body. A. Fixient gases can be considered physical toxicants because they act by displacing oxygen in the environment, but they are inert, not chemically toxic gases. Factors influencing toxicity. In some instances, the individual can have unpredictable reactants or idiosyncratic responses to a drug or other substance. An idiosyncratic response is uncommon and it is sometimes impossible to understand whether it is the result of a genetic predisposition or has some other cause, such as the status of the immune system. It could result in an abnormally small or short or abnormally larger or long response to the drug or other substance, or the response could be qualitatively different than what has been observed in most other individuals. The toxicity of a substance usually depends on the following factors: form and innate chemical activity, dosage, especially dose time relationship, exposure route, species, life stage such as infant, young adult, or elderly adult, gender, ability to be absorbed, metabolism, distribution within the body, excretion, health of the individual, including organ function, and pregnancy, which involves physiological changes that could influence toxicity. Nutritional status, presence of other chemicals, circadian rhythms, the time of day a drug or other substance is administered. Factors related to the substances. First, form and innate chemical activity. The form of a substance may have a profound impact on its toxicity, especially for metallic elements, also termed heavy metals. For example, the toxicity of mercury. Another example is chromium. Cr3 plus is relatively non-toxic, whereas Cr6 plus causes skin or nasal corrosion and lung cancer. The innate chemical activity of substances also varies greatly. Some can quickly damage cells, causing immediate cell death. Others slowly interferes only with a cell's function. For example, hydrogen cyanide binds to the enzyme cytochrome oxidase, resulting in cellular hypoxia and rapid death. Nicotine binds to cholinergic receptors in the central nervous system (CNS), altering nerve condition and inducing gradual onset of paralysis. Second, dosage. The dosage is the most important and critical factor in determining if a substance will be an acute or a chronic toxicant. Virtually all chemicals can be acute toxicants if sufficiently large doses are administered. Often the toxic mechanisms and target organs are different for acute and chronic toxicity. Example: toxicants ethanol, acute toxicity CNS depression, chronic toxicity liver cirrhosis, toxicant arsenic, acute toxicity gastrointestinal damage, chronic toxicity skin or liver sarcoma. Third, exposure route. The way an individual comes in contact with a toxic substance or exposure route is important in determining toxicity. Some chemicals may be highly toxic by one route but not by others. Two major reasons are differences in absorption and distribution within the body. Example: ingested chemicals, when absorbed from the intestine, distribute first to the liver and may be immediately detoxified. Second, inhaled toxicants immediately enter the general blood circulation and can distribute throughout the body prior to being detoxified by the liver. Fourth, absorption. The ability to be absorbed is essential to systematic toxicity. Some chemicals are readily absorbed and others are poorly absorbed. Example: nearly all alcohols are readily absorbed when ingested, whereas there is virtually no absorption for most polymers. The rates and extent of absorption may vary greatly depending on the form of a chemical and the route of exposure to it. Example: ethanol is readily absorbed from the gastrointestinal tract but poorly absorbed through the skin. Organic mercury is readily absorbed from the gastrointestinal tract. Inorganic lead sulfate is not. Factors related to the organisms. First, species. Toxic responses can vary substantially depending on the species. Most differences between species are attributable to differences in metabolism. Others may be due to anatomical or physiological differences. Example: rats cannot vomit and expel toxicants before they are absorbed or cause severe irritation, whereas humans and dogs are capable of vomiting. Selective toxicity refers to species differences in toxicity between two species simultaneously exposed. This is the basis for the effectiveness of pesticides and drugs. Example: an insecticide is lethal to insects but relatively non-toxic to animals. Antibiotics are selectively toxic to microorganisms while virtually non-toxic to humans. Second, life stage. An individual's age or life stage may be important in determining his or her response to toxicants. Some chemicals are more toxic to infants or the elderly than to young adults. Example, parathion is more toxic to young animals. Second, nitrosamines are more carcinogenic to newborn or young animals. Third, gender. Gender can play a big role in influencing toxicity. Physiologic differences between men and women, including differences in pharmacokinetics and pharmacodynamics, can affect drug activity. In comparison with men, pharmacokinetics in women generally can be impacted by their lower body weight, slower gastrointestinal motility, reduced intestinal enzymatic activity, and slower kidney function, glomerular filtration rate. Delayed gastric emptying in women may result in a need for them to extend the interval between eating and taking medication that require absorption on an empty stomach. Other physiologic differences between men and women also exist. Slower renal clearance in women, example, may result in a need for dosage adjustment for drugs such as uh, digoxin that are excreted via the kidneys. In general, pharmacodynamic differences between women and men include greater sensitivity to and enhanced effectiveness in women of some drugs such as beta blockers, opioids, and some antipsychotics. Studies in animals also have identified gender related differences. Example, male rats are 10 times more sensitive than female to liver damage from DDT. Female rats are twice as sensitive to parathion as are male rats. Metabolism. Metabolism, also known as biotransformation, is the conversion of a chemical from one form to another by a biological organism. Metabolism is a major factor in determining toxicity. The products of metabolism are known as metabolites. There are two types of metabolism. First, detoxification, and second, bioactivation. In detoxification, a xenobiotic is converted to a less toxic form. This is a natural defense mechanism of the organism. Generally, detoxification converts lipid soluble compounds to polar compounds. In bioactivation, a xenobiotic may be converted to more reactive or toxic forms. Cytochrome P450 CYP450 is an example of an enzyme pathway used to metabolize drugs. In the elderly, CYP450 metabolism of drugs such as phenytoin and carbamazepine may be decreased. Therefore, the effect of those drugs may be less pronounced. CYP450 metabolism also can be inhibited by many drugs. Risk of toxicity may be increased if a CYP450 enzyme inhibiting drugs is given with one that depends on that pathway for metabolism. There is awareness that the gut microbiota can impact the toxicity of drugs and other chemicals. Example, gut microbes can metabolize some environmental chemicals and bacteria dependent metabolism of some chemicals can modulate their toxicity. Also, environmental chemicals can alter the composition and or the metabolite activity of the gastrointestinal bacteria, thus contributing in a meaningful way to shape an individual's microbiome. The study of the consequences of these changes is an emerging area of toxicology. Distribution within the body. The distribution of toxicants and toxic metabolites throughout the body ultimately determines the sites where toxicity occurs. A major determinant of whether a toxicant will damage cells is its lipid solubility. If a toxicant is lipid soluble, it readily penetrates cell membranes. Many toxicants are stored in the body. Fat tissues, liver, kidney, and bone are the most common storage sites. Blood serves as the main venue for distribution. Lymph also distributes some materials. Excretion. The site and rate of excretion is another major factor affecting the toxicity of a xenobiotic. The kidney is the primary excretory organ, followed by the gastrointestinal tract and the lungs. For gases, xenobiotics may also be excreted in sweat, tears, and milk. A large volume of blood serum is filtered through the kidney. Lipid soluble toxicants are reabsorbed and concentrated in kidney cells. Impair kidney function cause slower elimination of toxicants and increases their toxic potential. Health status. The health of an individual or organism can play a major role in determining the levels and types of potential toxicity. Example, an individual may have pre-existing kidney or liver disease. Certain conditions such as pregnancy also are associated with physiological changes in kidney function that could influence toxicity. Nutritional status. Diet. Nutritional status can be a major factor in determining who does or does not develop toxicity. Example, consumption of fish that have absorbed mercury from a contaminated water can result in mercury toxicity. An antagonist for mercury toxicity is the nutrient selenium. Some vegetables can accumulate cadmium from contaminated soil. An antagonist for cadmium toxicity is the nutrient zinc. Grapefruit contains a substance that inhibits the P450 drug detoxification pathway, making some drugs more toxic. Circadian rhythms. Circadian rhythms can play a role in toxicity. Example, rats administered an immunosuppressive drug had severe toxicity in their intestine 7 hours after light onset compared to controls and to other times in the day. The rats had changes in their digestive enzyme activity and other physiological indicators at this dosing time. Other factors. Presence of other chemicals decrease toxicity, add to toxicity, increase toxicity, synergism or potentiation. Drug toxicity. Drug toxicity refers to the levels of damage that a compound can cause to an organism. The toxic effects of a drug are dose dependent and can affect an entire system, as in the CNS or a specific organ such as the liver. Drug toxicity usually occurs at doses that exceed the therapeutic efficacy of a drug. However, toxic and therapeutic effects can occur simultaneously. It can be assessed at the behavioral or physiological level. Behaviorally, drug toxicity can be inhibited in a variety of ways. Example, decreases in locomotor activity, loss of motor coordination, cognitive impairment. Examples of physiological effects include lesions to tissue, neuronal death, and disrupted hormonal cycles. Thank you.